Reducing risk of complications. Following surgery, you will be at an increased risk for certain complications. Knowing what these are and how to prevent them will help to reduce your risk of developing these complications. Preventing infection. Thanks to current infection prevention practices, patients undergoing joint replacement today have a very low risk of infection. These practices include optimization of your health and nutritional status, use of preoperative antibacterial soap, antiseptic prep applied to your surgical site and entire operative limb immediately prior to incision, which kills off any remaining bacteria not eliminated with the antibacterial showers, antibiotics, and improved surgical dressings. While these measures help to keep your risk of infection very low after joint replacement, there are still measures that we, as your healthcare providers, and you and your visitors can take to help further lower that risk. At the top of this list is good hand hygiene. This includes both the antibacterial foam and hand washing with soap and water. Both are equally effective in preventing the spread of germs. Hand washing and foaming stations can be found in every room and frequently throughout the hospital for staff, patients, and visitors to use. In addition to hand hygiene, follow all instructions given to you in regards to your surgical dressing and incision, including how long to keep it on, when to remove it, and when and how you are allowed to shower. Keep pets away from your incision and do not allow them to sleep in bed with you immediately before or immediately following surgery. No lotions, creams, or ointments of any kind to or around your surgical site until instructed by your physician. If you are a smoker, it's important to quit to further help decrease the risk of developing an infection. The next several complications we will discuss have one thing in common to help prevent them: mobility. All of the following complications can be greatly reduced by moving early and often following your total joint replacement surgery. Preventing blood clots. Orthopedic surgery and joint replacement put you at a higher risk for blood clots than other types of surgery. For this reason, reducing your risk of blood clot is a key focus of your orthopedic team. You will have intermittent compression devices placed on your lower legs. This is a machine which constantly inflates and deflates sleeves around your calves or feet to help compress your blood vessels and keep your blood circulating. You should have these on both legs whenever you are not up moving around during your hospital stay. This machine does not go home with you. For this reason, we recommend getting up frequently, about once an hour during the day, for a short walk around your home. Ankle pumps are another great way to keep your blood circulating when resting. Perform 10 ankle pumps with both feet every hour while awake. Your surgeon may order you to wear compression stockings or TED hose after surgery. These help to reduce swelling, which in turn can reduce your chance of blood clots. If ordered, you will be instructed on when and how long to wear these according to your surgeon's orders. You will also be prescribed a blood-thinning medication, such as aspirin. Your surgeon will decide which medication is best for you. Early mobility is key to reducing your chance of blood clots. Reducing blood clots is one of our main motivators to get you up quickly after surgery. Moving early and often is the best way to promote good circulation and reduce your risk of blood clots. Preventing pneumonia. After surgery, your respiratory drive can become depressed by anesthesia, medications, and reduced mobility. Taking bigger, deeper breaths helps to expand your lungs and force out any fluid wanting to collect there, which can lead to pneumonia. We will give you an incentive spirometer, or IS, and instruct you on its use when you arrive to your room. Use your IS 10 times per hour while awake. Take it home with you and continue using it for the first week once you return home. Being up to the chair for meals provides good positioning to help reduce risk as well. Early mobility, of course, also plays a key role in reducing your risk of pneumonia. Walking and activity forces you to take bigger, deeper breaths and expand those lungs. Preventing constipation. Anesthesia, reduced mobility, and the pain medications you will be receiving increase your chance of constipation after surgery. Nutritional status leading up to surgery and continuing an increased fiber and fluid intake after surgery helps to combat this. You will be given stool softeners while in the hospital and should continue these at home at least as long as you are taking narcotic pain medication. Laxatives may also be needed to take in combination with the stool softener. Early mobility helps to decrease constipation by increasing gut motility. Mobility equals motility. Urinary retention. Sometimes the anesthesia and medications used during surgery can cause some to retain urine in their bladder. Early ambulation and increasing water intake can help with this. Communicate with your nurse if you're having trouble urinating after surgery. Preventing falls. Lastly, but certainly not least, is the importance of preventing falls. Please be compliant with all of the following to help prevent a fall. Do not get up by yourself while you're in the hospital. Our staff are here to assist you. Call, don't fall. Wear shoes or non-skid socks or slippers every time you get out of bed or chair. Always use your walker when out of bed. Staff may also use a gait belt for assistance while walking with you. Use the handrails in the bathroom. If you wear glasses or hearing aids, use them. Staff will help you keep important items in reach. This includes your call bell. When you return to home, keep your walking pathway clear of any clutter or throw rugs that could cause you to trip and fall. Have someone available the first couple of days returning to home in case of an emergency.